to our speakers studio. We've got another fantastic guest come and join us here in the studio. Professor Bola Owolabi, MRCGP, MFPH with honours, and she is Director of the National Healthcare Inequalities Improvement Programme at NHS England, a GP working in the Midlands, and Vice President of the Royal Society for Public Health. Bola, welcome to the studio.
Good to be here, Simon. Thank you for having me.
Oh, pleasure. Absolute pleasure. Now, as I've looked on the agenda of what we've got you doing both today and tomorrow, you've got a busy schedule. I know you've done one session already today, Prison Radio, promoting well-being and reducing harm. How was that session for you this morning?
Well, it was an excellent session, and we were joined by our colleagues from the National Prisons Radio. And the work they've been doing with us is to promote health messages to people in our prison estates, especially in relation to something we call Core 20+5, which is NHS England's flagship program for reducing health inequalities. So they've been sending out messages about maternity care, about cancer, about chronic respiratory disease, about supporting people to quit smoking. And so it's been really important as a way of raising awareness about some of these long-term conditions for, you know, some of the most marginalized people in society, of which people in prison are a significant part.
Okay, well, what do you think the main sort of takeaways from that session, or what would you like the main takeaways to be from people who visited?
So 3 key takeaways. We asked people to go away with a pledge of what they are going to personally do to improve the health and the well-being of people in our prisons and probation service, so that we can improve people's health and also help to reduce reoffending. And the other thing that we heard loud and clear was to increase the messaging around diabetes through the prison radio. So we're going to be looking at that. And there was an excellent suggestion about how we can work with people with neurodiversity who have lived experience to actually support people in the prison and the probation service. So really excited that there are those 3 key messages that we can take forward and improve people's lot.
That definitely sounds like a session worth watching back on that one. So
absolutely.
As I look forward to that. And I'd say we've got other sessions. We've got another one this afternoon. We've got Ambulance Trust and ICSs working in partnership to address health inequalities. Tell us what to expect in that later today.
So I'm really excited about the ambulance session. We've been working with the Association of Ambulance Chief Executives over the last 2 years, recognizing that, you know, colleagues in the ambulance services, they visit people in their own homes. You know, they have reach into people's homes that many other professionals don't necessarily have, particularly people from our most disadvantaged communities. So I'm really looking forward to the conversation that we're going to have with the ambulance services about how they can use their reach to support people more, in terms of signposting them to services that are not necessarily emergency services, because many times people don't necessarily need an ambulance or necessarily need to use the emergency services, but they do need somebody to signpost them and guide them and connect them to community services, for example. So this is a conversation I'm really looking forward to, because there's great opportunity to help people better.
I can feel your passion. I can feel you're excited about it. So we very much look forward to that a little bit later on this afternoon. In terms of, in general, are there any examples you've seen at the show regarding innovation in the NHS that basically you might want more people to know about? Anything you want to share from an innovation perspective?
Well, there's an excellent example, which is the Innovation for Health Inequalities program in HIP. And this is a program that we are delivering in collaboration with the Accelerating Access Collaborative. Incredibly exciting. Each one of our 42 integrated care systems are working through their health innovation networks to increase the uptake of NICE approved medicines in our most disadvantaged communities. So, for example, in Greater Manchester, they've increased the uptake of inclisiran, which is a medication that lowers cholesterol and therefore prevents heart attacks, prevents strokes. And they've rapidly increased the uptake of inclisiran amongst our Black, Asian and ethnic minority populations. For example, in Yorkshire and Humber Health Innovation Network, they've increased the uptake of something called Pheno, which is reducing emergency admissions for asthma in our children and young people. So just a fantastic example of how innovation is making a real difference in reducing health inequalities. That's just fantastic.
I love the insight you can give there, and that's what you get out of shows like this, when we bring people together. So I really appreciate you sharing that. Sort of moving on and looking forward to tomorrow, because I say we've got you back for even more sessions tomorrow. We're working you hard this couple of days. Tomorrow we've got clinical leadership for community empowerment, improving access, experience and outcomes. Again, if someone's thinking of attending that tomorrow, what can they expect from that session?
So I would really encourage people to join us in that session. We recognize that our clinical leaders are incredibly important and very influential people. And the conversation we want to have is how can they use their impact? How can they use their influence to really address health inequalities in the patients that we look after? Bearing in mind, I'm a GP myself, and I want us to have a discussion about understanding the wider issues going on in people's lives and seeing them in that whole person way, not just in terms of the individual conditions that people present with. And that is particularly important for people such as homeless people, some of our traveler communities, people whose first language is not English, for example, people who are really struggling in a socio-economic way. They may not be able to afford those medications we're prescribing, etc. And it's just empowering clinical leaders to understand that people are more than the condition that they present with. And so we're looking forward to having that discussion tomorrow and help people better.
No, I love that people are people. They're not just statistics. They're not numbers.
Absolutely.
They're not conditions. So no, I absolutely love that outlook. In terms of how can we ensure that innovations in healthcare are made accessible in an equitable way, and also keep in line with the ethos and purpose of the NHS as a whole?
So it's wonderful that the NHS Constitution specifically says we need to add value for all, especially those who otherwise would be left behind. So in terms of making innovation equitable and accessible to all, the first thing we need to do is be inclusive by design. So right at the point where we're thinking about a particular innovation, which voices are not in the room? And for us to proactively look for the voices that are not in the room and design those innovations with them. That's the first thing, inclusive by design.
Love that.
And the second thing is we should look in the rear view mirror. When we roll out those innovations, are we using the data to help us see who is getting left behind? So for example, we've published NHS England's digital inclusion framework. And we've done that because we recognize that digital is absolutely fantastic as long as we look in the rear view mirror at those who may not be able to travel on that digital journey as fast as everybody else. Inclusive by design, look in the rear view mirror by looking at your data, and if we find that people are being left behind, we course correct.
Now, gold. You're nailing all these points there, loving it. And in terms of what has been your approach to problem solving in the complex sort of context of healthcare as a whole?
What I've learned is that the answer lies between us. No individual or organization working as a lone actor is going to make a difference in the complex issue of healthcare. And what I've discovered is, in talking to people and communities, in talking to colleagues from other sectors and from other organizations, suddenly conversation becomes a powerful tool for discovering ways forward that you wouldn't have thought about on your own. And that's one of the things that I've learned, that however complex and challenging our healthcare issues are, the answer does lie between us. And so for me, it's about humility, that we don't have all the answers. It's about making room for conversation with others. And it's about actually honoring the time we've spent in those conversations by doing something. So turn conversation into action. So humility, conversation, and action will get us a long way.
Fantastic. And in terms of, events like these, how important do you think an event like this is to start those conversations, to be part of it?
So events like these, for me, I've had some fantastic conversations already today, and I'm looking forward to many more. And I will really encourage colleagues to pause and talk. These 2 days are a fantastic opportunity. We're seeing one another in person, post-COVID. That is a luxury. Let's take the most and make the most of the next 2 days to have those meaningful, purposeful conversations about what we are going to do next when we leave here in service of the most disadvantaged in society.
Bola, it's been an absolute pleasure talking to you. I say thank you for coming and having a conversation with us and sharing your wisdom. It's been gratefully received, so thank you.
Great to talk to you, Simon. Thanks for having me.
Pleasure. So that was Bola. So, ladies and gentlemen, we are going to go now and show you a session from one of the other stages. It was pre-recorded earlier this morning. It is Victoria McDonald, from Health and Social Care Editor of Channel 4 News, and she is in conversation with Tanuke Awe and Clotilde Rebecca Abe, co-founder of 5 Times More. They're going to be discussing their organisation's work to address this disparity and reflect on the role of grassroots organisations in advocacy. So we're going to show this session. Hope you enjoy.